A spike in cases of the Delta variant are renewing discussion about a vaccine booster shot. This week, Dr. Anthony Fauci said people with compromised immune systems will likely need it. But CBS 2's Marie Saavedra found that some of those patients are already getting their third doses of vaccine. Marie.
Erica, if you are in any of those vaccine groups on Facebook, you may have stumbled upon a post from someone saying that they received more than just their second shot of a vaccine. In the comments, you'll find people clamoring for information, wondering if this is a booster shot and wanting to know more. Well, we have learned it is technically not a booster. In many of these cases, this is trying a second time to get that person protected.
As somebody who is immunosuppressed, I had to be very careful.
Pilot David Barron says the risk of COVID kept him grounded since the start of the pandemic.
I actually haven't worked since March of 2020. I've been on leave because it was just too risky.
He lives with an autoimmune disorder of the skin, so to stay healthy, he got 2 shots of Moderna as soon as he could, to no avail.
Not at all. I had no detectable antibody response.
He says his medications kept the vaccine from taking, so his doctor at a well-known Chicago hospital suggested getting another dose.
The option was given to me by my treating physician. It was my decision. He did not push it on me, he just kind of laid the information out.
Barron got a J&J shot in June. Since he had no antibodies after the first round, technically it's not a booster. It's just another attempt to get him protected. But discussions about giving extra shots to the immune suppressed are happening.
The data that we're accumulating now is really real-time data that started when the vaccines were available in December.
Dr. John Fung is co-director of University of Chicago Medicine's Transplant Institute. He says recent studies, including this one published Friday in the New England Journal of Medicine, show a third dose of vaccine in organ transplant patients significantly improves their ability to fight COVID. But it's still early, and boosters in those who did have some antibodies but want more is not approved by the FDA or CDC.
Let them figure out whether or not this third dose makes sense or not.
For Barron, his third dose acted like a first, and he's grateful to finally put up a fight against this virus.
I can see family and friends. I can, go out to restaurants with my wife. I can return to work, and get my career back on track. And it's my gateway to returning to normal.
If you or someone you know is immunocompromised and you're curious whether or not your vaccine did take, talk to your doctor. They can do that testing for antibodies to see what the situation is and then decide if you do or do not need another shot of the vaccine. Brad, Erica.
All right, Marie, thank you.